All right, good morning, everybody. Welcome to session 3 of our Small Ruminant Workshop series. The North Florida Livestock Agents Group is a group of about 10 or 11 agents currently across Northeast Florida that works with all livestock and natural resources species. Our Small Ruminant Workshop is generally often in person in Gainesville this time of year, but of course with restrictions this year, we have moved virtually. So we're going to go ahead and jump into our first presentation of parasite prevention. So parasite prevention in small ruminants is really important. Small ruminants are one of our livestock that are really susceptible to major effects production-wise and health-wise with parasites, especially some particular species which can cause really large anemias in our sheep and goats and actually cause them to die. One of the largest death causes in small ruminants is actually parasites. So that prevention is going to be really important. So there's two types of parasites. We have an external parasite and internal parasites. External parasites are located on the outside of the body, on the wool, fur, or hide. These can be insects that actually live on the animal or just are bothersome like flies and whatnot. Internal parasites actually occur inside of the body, generally in the digestive tract. Some of them actually can get into the bloodstream, but that's a little different. But generally, when we're thinking of parasites, we have the ones outside we need to treat and the ones inside. So for external parasites, the three main pests that you're going to see in small ruminants are lice, flies, mites, and fleas. Flies, of course, aren't actually living on the animal 24/7, whereas lice, mites, and fleas are. Fleas, especially stick-type fleas, you can notice the black margins all around their face and whatnot. You'll actually see the animals there, versus mites and lice. It's not likely that you'll see them unless you're really looking over the animal. So some symptoms that we can notice when animals are facing external parasites are scratching, hair loss from the rubbing on fence posts or barns or things that you have available out in the pasture, trees and whatnot. And in severe infestations of the blood-sucking pests, especially lice, mites, and fleas, we can see some anemia presentation in our animals as well. So the control of these species, one is through management, especially. We want to make sure we're quarantining any new animals and determining if they have infections before introducing them into our herd. So we want to stop it right at the door. But any type of, if our animals do come down with lice, mites, or fleas, that control is going to be really dependent on what type of product you're having. If you have dairy goats per se, meat goats, meat sheep, or have a wool product, the product that you're producing out of these animals is going to have restrictions on what products you can actually use. In Florida, we're really lucky. We have this website that is specific to a few states, Florida being one of those, called veterinaryentomology.org. And you can actually go on there, choose what type of animal that you have, the class of that animal, if it's, pregnant ewe, pregnant doe, does, rams, anything of that sort, bucks, and can choose on there what type of class you have and then what insect you're facing. It'll give you specific control recommendations that are legal in Florida and legal for the animals that you have. Flies, on the other hand, there are some limited control methods that we can use for those species. But flies are better managed through the management of your operation, making sure that we're keeping manure away and clean, where getting rid of any type of sources where flies could lay eggs. So if you have a compost pile with your manure, making sure that's far away from our animals, and just keeping track of the cleanliness of our operation, and that will help reduce a lot of the flies. There are also some fly products that aren't chemical. So like our fly predators, which go after a number of species, barn flies and stable flies and such. And those can be really beneficial as well. You just have to determine if that's cost effective for your operation. So with small ruminants, probably the most common parasites that we deal with are internal parasites. And there are a number of species that can affect our small ruminants that are pretty much all roundworms. And the most prominent one that we see in Florida is the barber pole worm. It's part of the Homunculus species. It lives in the abomasum of the small ruminant. And that's the one that causes the most death because it is a blood-sucking parasite and causes severe anemia. Their populations can explode relatively quickly and cause severe anemia without you even noticing if you're not managing it properly or keeping track of your animals. And you can experience a lot of death loss through that. Our other ones, we see some in the small and large intestines, again, all roundworms. These worms do cause some issues in our small ruminants, but we don't experience as much death loss associated with these unless they have a severe overload of adult worms, which is causing digestive issues or potentially anemia as well. So you don't really need to remember the scientific names or even really the common names of these. You just need to be aware that there are a number of parasites that can affect our small ruminants. So how do we control these small ruminants parasites? Their number one way is through management. So we want to make sure we're using as little chemicals as possible in our operation. It's going to save us costs if we don't have to purchase dewormers. We don't have to run animals through the chutes and actually manage them and handle them. We don't have to buy needles or drenches and all that. So management is going to give you the most effective control over a long period of time. And it's also going to be the easiest on you and provide other benefits in ways of grazing and whatnot. So the first thing we want to make sure we're doing is we're not going to graze our pastures below 3 inches. So the way these animals are being infected by these parasite eggs that are in the ground is they're grazing closer and closer to the ground. And those parasites, once they hatch out of those eggs and are in the first larval stages, they can actually travel up that blade of grass, especially in wet pastures. Water, it helps them move. So if there's dew or heavy rains in Florida like we get, and you have wet pastures, wet blades of grass, you have high parasite eggs, that's going to trigger them to hatch. And those larvae are going to travel up that blade of grass, and your animals are going to be able to consume that. If your grass is larger than 3 inches, then the likelihood of your animals being infected just from the ground is a lot less. And that cycle is just going to continue if your animals are getting parasite eggs from the ground, and then they're going to mature in the animal. That animal is going to produce more eggs in their feces and manure, and that's going to, of course, be in your pasture and just going to reinfect that animal and other animals in your herd. So always make sure that we're not grazing less than 3 inches. If you have the ability to restrict their grazing on wet pastures, put them in a dry lot overnight and not allow them out, in the dew of the morning or whatnot. If in a small herd situation, that can be really beneficial as well. And that's going to be beneficial for your pasture as well. We don't want to overgraze. The next management technique is to rotate pastures. So rotational grazing is amazing for pasture management, but it's also amazing for parasite management. And the reason we want to rotate pastures and allow them to have the most amount of rest between grazing events is because of the life cycle of those eggs of the parasite. So if your animals are infected with adult worms, which are producing eggs, which are then released in the feces of the animal in that pasture, if you're moving and rotating pastures and your herd is not coming back to that pasture for 3 months, 6 months, it's likely that there's going to be an optimal time period for those eggs to hatch during that rest period, and they're not going to have anything to infect. So once they hatch out of that egg, they have to have a certain time period to get into an animal in order to survive. They can go dormant in the egg stage if there's not optimal conditions to hatch, which we really can't control. The longer the rest period, the least likely you are to have that, or have a higher load of dormant eggs. But try your best to rotate our pastures. However you can do that, whether you actually have long-standing fences, or electric fences, or however you have the ability to rotate your animals. If you can do multi-species grazing, that will give you the benefit of, say you have a smaller amount of land and you can't allow your animals to rotate and give a particular section that long of a rest period, but you have the ability to rotate multiple species through those pastures. That can be really helpful because a lot of our parasites only affect one species or the other, particularly like cattle, horses, and small ruminants. A lot of the parasites that affect sheep affect goats, but they don't affect horses and they don't affect cattle. So if those animals are grazing and consuming those parasite eggs, they're not going to flourish in those animals. And essentially that would be the end of the life cycle of that egg. And then your sheep or your goats can move back into that pasture. And even though it didn't have as long as a rest period, those eggs were removed by the other animals. So that can be really beneficial as well. And whatever parasites those cattle and horses may be unloading on that pasture are not particularly going to affect your small ruminants. The next management technique is selection of our animals. We want to make sure we're choosing resilient and healthy animals, and we're not overstocking our pastures. So we don't, again, want to overstock, so we're not getting to that point where we need to graze pastures below 3 inches. And we want to make sure that we're breeding or purchasing animals that are resilient to parasite loads. So they're not showing production effects like weight loss or hair loss or anemia, even when experiencing medium to higher loads of parasites. If we're saving a particular doe or ewe constantly from parasite infection, and she's the only one in the herd you're consistently treating, it's likely we don't need to breed that animal. For some reason, she's not genetically superior in parasite control and management on their own. And we want to choose animals that we have to intervene the least amount possible. So make sure when you're purchasing animals, you're asking about their previous parasite infections and dewormings and how consistently they need to be dewormed. And when we're breeding our own animals, that we're keeping track of that in our animal records and making sure we're not breeding animals that are susceptible. So how do we determine if an animal is being susceptible to parasite loads, what their current parasite load is? There's two probably most effective and common ways, which is the FAMACHA method. So this is an anemia guide where we're looking at the soft membranes in the eyes of our small ruminants and determining what their level of anemia is. You can see on the slide here the scorecard that you would use, that you're going to match the color of their lower eyelid to that scorecard to determine their level of anemia. So of course, optimal, we want nice bright red, blood-filled soft membranes. And if we're getting into those lower, paler colors, obviously the paler that that mucous membrane is, the less amount of blood that's flowing through there, and likely the higher level of anemia that your animal has. So if we're getting closer and closer to white, we need to treat that animal immediately, or potentially, experience a death loss in the flock. So especially if that is white, then we want to dose almost immediately. Now, there are other health issues that can lead to anemia. So just because they're anemic doesn't mean they're facing a parasite load. There are other symptoms and stuff that we need to look at. If your animal is really experiencing some other symptoms, it's probably better to have a veterinarian get involved to make sure that it is a parasite load. Something that can help us determine that it is parasites and not another disease or condition is fecal egg counts. And so regular fecal egg counts in our flock is going to be really beneficial. What this is doing is it's actually determining what species and the number of eggs are in the feces of your animal. This is better, of course, if we can test these on individuals and not as a whole flock basis, but you can restrict your animals to a smaller area, some type of dry lot, and take an average amount of manure across the lot after a day or so and test that, and that will give you a good recommendation for your flock as a whole. Generally, we recommend with fecal egg counts that we're doing a fecal egg count for each individual animal, or at least individuals as a percentage of your flock. So maybe 10 or 20% of your flock, you're going to take fecal egg counts for those to reduce expense, determine what their parasite load is, and then determine whether you need to treat those individual animals or the flock as a whole based on recommendations from your veterinarian. But always make sure that we're utilizing at least one of these two techniques to make sure that we're treating animals that need to be treated and not utilizing dewormers where they're not needed. So if we do need to deworm, there are 3 types of classes of dewormers that we can use in small ruminants. Most likely you'll recognize the ingredient names like fibenzidol, ivermectin, pyrantel. Pyrantel is generally what we use for tapeworms. And then we generally think of fibenzidol and ivermectin, or moxidectin is a popular one with small ruminant products as well. These 2 classes of drugs are generally what we utilize for our roundworms, although pyrantel can do roundworms as well. But these 3 classes of drugs are important to know about because you want to make sure when you're choosing a product that we're not utilizing the same ingredient over and over and over again in our animals, and that the ingredient that we choose is actually going to control the parasites that our small ruminants are infected with. And that's where the fecal egg counts can come in handy, where we can actually determine by the morphology of that egg what type of species a parasite our small ruminants have, and then choose a deworming ingredient that will actually control that species. So make sure that you're choosing a product that will actually control the parasites that you have, and that we're not promoting resistance by using the same product over and over again and not experiencing any control. If you're experiencing control, it's perfectly fine to use the same product over and over again with the same active ingredient. So how do we deworm smartly to promote resistance? One, like we talked about, we want to use effective dewormers. This is identifying that class of dewormer that would be effective based on what parasites your animals are infected with. We want to deworm strategically, so only deworm your animals that need treatment. If your animals are not exhibiting symptoms of anemia or any other symptom of a high parasite load, then it's not likely that that animal needs to be treated. We don't need to treat our whole flock with dewormers to control parasites multiple times a year or even once a year. Again, we want to be choosing and selecting those animals that can control the parasites on their own and don't require intervention. With medicines, we want to make sure that they are able to survive with a medium to high parasite load, and we only need to treat them if they're getting to a certain level of health issues. Treating all of your flock will promote resistance because it's not going to provide 100% control of the parasites that your animals are infected with. So the living parasites that are still left after you deworm now have been exposed to that drug and have built a small level of resistance. Over time, as you do this, you're going to increase that resistance level in your flock, and then you're going to be dealing with a major problem, because when you do have animals that get to a high parasite load and are showing symptoms health-wise or production-wise, you won't be able to treat as effectively, because now you've built this resistance in your operation to either one particular drug or a host of deworming drugs. And we want to make sure that we are promoting effectiveness if we do feel like resistance is suspected in our flock. So maybe you have been consistently deworming, you're worried about resistance, or there is also a lab, I believe it's in Georgia, that you can send fecal egg samples to, and they will actually determine your resistance level in your animals. I can post a link to that in the chat as well. But that will be really helpful for you to utilize if you suspect resistance in your flock already. If you do think you have resistance, we want to make sure we're using at least 2 classes of dewormers to try and provide the most effective control and kill those adult parasites that are experiencing some level of resistance to drugs. And we're going to use those 2 different classes at the same time. We want to make sure that before we're treating, we are holding animals off of feed for 12 to 24 hours. This slows their digestive system down and makes it to where our dewormers are going to be a lot more effective. And what this is doing is it's allowing, after you hold them off of feed, they're not digesting as fast, and they're going to, that dewormer that you're going to inject into their orally in their mouth is going to stay in their digestive system longer. It's likely to have a higher level of control as it can, be taken up by those adult parasites for a longer period of time. After you deworm them, you're welcome to put them back onto feed. We don't want to do this with any of our pregnant does or ewes. We want to make sure that they are, especially in late gestation, we don't want to hold them off of feed. So make sure you're only doing this with dry does, dry ewes, or bucks and rams. And particularly that's only beneficial for a few of our products, like the benzomidazoles, ivermectin, moxidectin, or doramectin. So some of our long-term management strategies, we want to deworm the flock additions. So any new animals that you're purchasing and bringing onto the farm, you want to make sure that we're deworming them before we introduce them into our herd, because you don't know what their parasite load is. It would be better if you could get a fecal egg count on them, determine what parasites they have, how that compares to the parasites you currently have in your operation, and whether or not you can introduce them into the herd before deworming or not. Of course, if you're buying larger amounts of animals, this isn't financially feasible. So we want to make sure we're deworming that flock, the new flock, with at least 1 of each of the 3 classes of dewormers. Would be better if you can deworm them at the same time with all 3 classes of wormers. When you bring in that new animal, it would be better if you can put them on a dry lot. So essentially this is a sacrifice area of our operation where we're going to house these animals and not allow our current animals to be exposed in that area for some time. Because again, if animals are infected with an adult parasite, they are constantly shedding eggs in their feces. So we want to make sure our current animals that are, maybe not experiencing that small ruminant parasite load are not encountering those new eggs. So take that until those animals have a negative fecal egg count or a low parasite load. And again, use dewormer sparingly in your herd. We want to make sure that we're not, again, just deworming for no reason. We're just deworming because we feel like they must have high parasite loads. We're in Florida, et cetera, et cetera. We only want to treat animals that need to be treated. And even then we want to treat them sparingly. Don't continue to breed animals that are susceptible to parasites, and that will help you in the long term. Practice good pasture management. So again, like we talked about, don't overgraze, rotate your pastures if you have the ability, make sure that we have a good amount of forage to utilize. With goats, the more browse that you can have available for them, the happier they'll be, and the lower their parasite load will be, because parasites are not generally located on browse. They're going to be located closer to the ground for them to get infected or reinfected. Two things we always have to remember with any type of drug, but particularly with dewormers, is our withholding. We always want to make sure that we're following drug withdrawal periods that will be located on the label for the class of animal that you have. Make sure, if it's 10 days to slaughter, or toss milk for 20 days, whatnot, that we're following that. That's really important for food safety and also just consumer trust. We want to make sure, and of course it's a law, we want to make sure that we're not the ones that come back and have residue in our products and then are going to be investigated related to that. In the same capacity, the label is the law on what products you can use. So don't use a product that's in pregnant does that says this is not acceptable for pregnant animals, or don't use a product for cattle if it's not labeled for small ruminants. You want to make sure that the species and class of animal that you have is acceptable for that product that you are using. There is kind of a caveat to that, where veterinarians can prescribe things outside of the label. But again, that's a prescription from a veterinarian. You cannot do that on your own. Your protection there would be from the veterinarian, and they would have to give you a specific withdrawal period for that new prescription that would tell you how long you would have to go before you can slaughter or utilize the products from that animal. So this is my information. If you have any questions or want to get in touch in the future, I'll go ahead and answer some questions. I see we have a lot here. So Tammy, you have a couple images of parasites. We can address that later. We'll respond to that email that you sent. How far do the parasites move, meaning they can go from one paddock to the next paddock, or they just go up the blade of grass? So the only way that parasites are moving from one paddock to the other is by your live animals. So those animals are consuming those eggs in one pasture. They're maturing into adults, parasites inside of the digestive tract of your sheep or goat. And then as you move them to the next pasture, those adult parasites that are located inside of the digestive tract are producing eggs, which are then going to be released in the feces of the animal in that next paddock. And so if you're following animals, say you're grazing one herd and then grazing another herd after that, of different classes of animals to keep them separate or whatnot, then if that first herd is infected and then you bring in the second herd into that paddock, those eggs that the first herd released are going to infect the second herd and whatnot. Those eggs have a small time span from once they hatch into a larval stage to when they can actually infect an animal. I believe Depending on optimal conditions, it's usually less than 14 days. So we want to make sure that, but those eggs don't have the ability to, get up and move. They don't have egg legs particularly. They can only travel up and down that blade of grass. It's like a little tiny worm. You wouldn't really be able to see it with the naked eye, is essentially what that looks like. And so it's traveling in the dew and the water on the blade of grass. They really can't move even more than a 1 square foot area. How long do the parasites live? So the larval stages can live, I believe, for 2 weeks. It's going to vary based on species and whatnot. But then it's, again, that's only after they hatch. Those eggs can live. I mean, we have recorded eggs that are staying dormant for 4 to 6 months or longer until there's an optimal time for them to hatch. And they're not all going to hatch at once. So some of them are going to stay dormant and some of them are going to hatch. It really just depends. So, and those adult parasites can live for a rather long time in your animal, not just weeks, I mean, months and months or longer, and continuously shedding eggs. So that's why we want to make sure we have animals that are resilient to adult parasites. Do pigs and fowl have the same parasites as goats and sheep? Not particularly, especially fowl. A lot of our pests that are specific to fowl species, chickens and turkeys and ducks, they may have the same common name, but it's typically a different species. So where there's very few parasites that can affect multiple species of livestock. Again, they have the same name that we refer to them as, like coccidiosis. I'll use as an example. Coccidiosis is a really big issue in kids, especially lambs as well, and chickens, pigs, horses, cows, all of those species of livestock can get coccidiosis. But the actual coccidia that infects each species of animal is not the same. So we call them the same, it's in the same family, but the scientific name is different. So that's why we encourage multi-species grazing, to utilize all of the forage produced in your pasture, but you're not going to be passing parasites around from species to species. To test your own livestock, could we use a microscope with 40, 100x, up to 1,000 power, or do we need something else? That's perfectly fine. Those fecal egg counts, they're relatively cheap to send off. If you have a large, generally a veterinarian will do that for $10 or $15. Even sending it to a lab is usually that cost. If you want to learn and have that ability, or have a larger herd and want to cut costs, yes, absolutely. 1,000 power is way sufficient. I've done fecal egg counts on 100 power as well. You can get some relatively cheap microscopes. You do have to have a particular slide for that. It's called a McMaster slide. But if you're interested in doing your own fecal egg counts, there are a lot of tutorials and stuff out there to do that. We often teach fecal egg counts in this program as well in person. So yes, certainly you can do that on your own with a relatively easy microscope. If you've treated with ivermectin and have recounted with the new count being manageable, is it necessary to retreat after 10 days? So that's going to depend on your product. If the product recommends retreatment, then you certainly can. If you have any treatment or drug questions, I would highly recommend consulting your veterinarian. They know your operation best. If you're coming back after the first treatment with an acceptable fecal egg count, then to my knowledge, there would be no need to retreat because you had that effective level of control with the first treatment, and you want to reduce cost and use of dewormer as much as possible. But always consult with your veterinarian for specific recommendations for your operation. Is it possible to view the previous workshops 1 and 2? Yes, absolutely. So this website here, which I'll post a link in the chat session, after I'm done sharing my screen, and that is going to have all of the recordings of our programs. So sessions 1 and 2 are already up, and all the supplemental materials related to the programs will also be there as well. So you can take a picture of this slide, or I'll post it in the chat as well. And you'll receive an email after the 18th when we have our final series. Anyone who registered will receive a link to this email and to our survey as well. Okay, looks like that's all of the questions for parasite prevention. If anybody else has any questions, I will be happy to answer them in the chat.